Well, hello, everyone. My name is Jamie Brandis. I'm at the Colorado Small Business Development Center Network's SBDC TechSource Commercialization Program. I'd like to welcome you all today to Health and Human Services, or HHS, ACL/NIDILRR's SBIR program. I know that is a mouthful. So to break down the acronyms really quickly, NIDILRR is the National Institute on Disability, Independent Living, and Rehabilitation Research. And this is under the Administration for Community Living, which is what the ACL stands for. Very briefly, I would like to introduce you to our state's TechSource commercialization program. This program is designed to support science and technology ventures throughout Colorado. Businesses are pre-startup through advanced second stage, so if you have an innovative technology, you're likely a fit for the program, regardless of your stage of business. SBDC TechSource commercialization does focus especially on sources of non-dilutive capital where there's no equity given, technology commercialization, and SBIR STTR grants. We also cover R&D tax credits, government accounting, IP protection, access to capital, and market research. We provide customized expert consulting at no cost to you, as well as relevant workshops, events, and accelerator programs. After this webinar, if you're interested in meeting one-on-one with a TechSource commercialization specialist or attending events, workshops, or webinars, please visit our website, which is sbdc-techsource.org to get started. These resources are available thanks to support from SBA's FAST program, VISA, the Colorado Office of Economic Development and International Trade, and the City of Boulder. Just a few quick things. If you're located outside the state of Colorado, we encourage you to check out your local SBDC and resources for your individual state. We do focus most of our resources on Colorado. You will receive a copy of today's presentation slides, as well as a link to the recording of today's session. After we complete the session today, there will also be a handout that goes along with that. And just a few housekeeping things. All of you are currently on mute. If you have questions, please type them into the Q&A bar at the bottom of your screen, and we'll get to them at the end of the session. We're going to leave lots of time for Q&A, so please do enter your questions there. So right now, I would like to introduce you to today's webinar presenter, Brian Bard. Brian is the program manager of the Small Business Innovation Research, or SBIR, program at the National Institute on Disability, Independent Living, and Rehabilitation Research under the Administration for Community Living under the Department of Health and Human Services. Before joining NIDILRR, Brian worked at the Office of Special Education and Rehabilitative Services under the Rehabilitation Services Administration as a grants management specialist handling assistive technology formula and discretionary grant programs. Brian's portfolio includes grants in the SBIR program, the Spinal Cord Injury Model System, technology-related field-initiated projects, Schweitzer Fellowships, and others. Now I will turn it over to Brian. Thank you so much for presenting today.
Thanks, Jamie. Thanks for the exposure to our program. Great. It's great to have exposure to new potential grantees. NIDILRR, we pronounce that acronym NIDILRR. When you look at it, you might think it's NIDILRR, but we like the sound of NIDILRR better. So that's how we use the acronym. And as Jamie said, we're under ACL, the Administration for Community Living, which is under HHS, Health and Human Services, and that is a separate branch than the NIH, the National Institutes of Health. We are not part of the NIH, and our program is very different. Next slide, please. So our program is very unique because we are the only program throughout all of the SBIR programs that its sole purpose is to fund small business grants to perform research and development designed specifically to improve the lives of people with disabilities. And to apply for a grant from ACL or NIDILRR, that is, you have to address some subset of that population. We are a very small program. Our budget is approximately 3.2, sometimes 3.4 million per year. We gave out a couple of more grants last year, so we're probably closer to 3.4 million for 2023. And we only hold one phase 1 competition each year, which is announced around mid-October, and one phase 2 competition each year that will be announced sometime in January, probably. Next slide, please. And so most of you are probably familiar with SBIR, but of course it's a 2-phase program. Phase 1 is a prototype phase, and you have to develop a prototype, a model, or proof of concept. At NIDILRR, we give awards for $100,000 for a 6-month project period. We give approximately 10 awards per year. Last year, we gave 12, or I should say for 2023, this fiscal year, we gave 12, and we usually get 40 to 50 applications. And in phase 2, of course, the idea is to further research and development to bring your concept to commercialization. Not necessarily ready to put it on the shelf and sell it, but we like to see progress in that direction, realizing that our grants are relatively small compared to other SBIR programs. And phase 2 is only $575,000 for a 2-year project period. And that is split evenly between both years at $287,500 per year. Again, it's a 2-year project period. We usually give 4 to 5 awards per year. This year we did give 5. We usually get 14 to 17 applications. This year, I think we only got 12. I forgot, 12 or 14. We invite phase 1 grantees throughout the federal government. So you can bring your phase 1 project from another SBIR agency, as long as it's been within the last 2.5 years approximately. At any given time, we have 8 or more active awards. This year I think we have more because a lot of our phase 2s go into no cost extensions. Next slide, please. We do have a funding restriction on mobile apps. We do have an app factory at NIDILRR that is a separate funding mechanism. And it's probably a good time for me to mention that NIDILRR has other funding mechanisms besides SBIR that a small business would be eligible for. We have the Field Initiated Program. We have Switzer Awards and a variety of other awards. And I have links to websites where you can get information from our other funding opportunities. We don't have authority to do fast track. We also don't do direct to phase 2. We don't do phase 2B, and we don't do TABA. So we're not participating in many of the other programs that you'll be familiar with if you're familiar with other SBIR programs throughout the NIH or the federal government. As far as indirect cost rate agreements go, another difference is the NIH, you can ask up to 40% of indirect costs without an indirect cost rate agreement. We are not allowed to do that. We can only give up to 10% unless you have an indirect cost rate agreement, a negotiated rate. So if you don't have one, you would want to get one before you apply, or you'll be limited to 10%. And another big difference is your indirect costs and fees. If you take the 7% fee, all of that comes out of the grant funds. So we don't add to your $100,000 or your $575,000 with those amounts. Those come out of your grant. These links are to prior phase 1 awards and prior phase 2 awards. Our commercialization success rate is actually over 50%. These examples that are, things that we funded for low vision, navigation, readers, tactile devices. We used to do mobile apps, but we don't do anymore. Prosthetics, dialysis devices, all kinds of switches, software for hearing impairment, wheelchair navigation attachments. We did a water bottle holder, believe it or not. Really a bunch of different things. Next slide, please. Your chances of success with NIDILRR through the years are, right around 26%. In 2020, when we introduced the mobile app restriction, we went way up to 59% because, we were getting a lot of applications for mobile apps. And when we shut that spigot off, we didn't get a lot of applications that year. But your chances at NIDILRR are, I think, a little bit better than most agencies. Next slide, please. And our phase 2 chances are even better. In 2023, your chances with the 12 applications would have been 42%. So that's pretty high. Next slide, please. Now, these links are important, and you're probably already familiar with grants.gov, but when you go there, you can search for our acronym NIDILRR, type it in the upper right-hand corner, and then over to the left, you can click on closed, which I think is a 90-day window, or archived if you want to go all the way back to last year and previous years. And there you can look at our previous funding opportunity announcement. I would recommend downloading the one from 2023 and using it to get started on an application while you wait for the December 16th forecast to come out. It's there, but it's only a forecast, so there's no package to apply to yet. But again, if you download last year's, you can get 95% of it done. There will be some differences this year because of the new regulations with due diligence for foreign influence and things like that. So definitely go to NIDILRR, do this search, and save the results. And then you'll get notified when things get changed. And there's other ways to do that too that I'll talk about. We use grant solutions when you work with a NIDILRR grant. So if you're going to apply, once you apply, you would want to go to Grant Solutions and become familiar with that, at least take a look at that website. And we also use this specific particular reporting tool, which is the next link, and you can also take a look at that. I wouldn't worry too much about those until you, after you apply. I would spend your time right now on working on the application. For technical assistance resources, we have links to the NIH Life Sciences. The state contacts can be useful there. There's another link there for local assistance that some folks have found useful. Although we are not part of the NIH, and of course there's the FAST program funded by the SBA. And although we're not part of the NIH, a lot of folks have gotten assistance through those first 3 links with application preparation. The 4th bullet is the Impact Center. That is a NIDILRR funded program, and it helps phase 1 and phase 2 grantees work with their grants. They do not help you prepare applications, but they have hosted a resource program and success stories where you can download sample applications. I don't know if they're phase 1 or phase 2 applications. I have to find that out. But that's definitely worth the look, see if you're going to apply. We are very different. Our applications have a 40-page project narrative limit. So that's much more than NIH. And that allows you to explain things in a lot of detail to the applicants. And one tip that I'll give you is that, to the reviewers, one tip that I'll give you is that our reviewers are assembled ad hoc each year. We don't use standing panels like the NIH does. So every year I have to, recruit reviewers, and, they are from a variety of backgrounds, all disability related, but we don't get enough applications that we can have one panel that's all, like hearing assistance, and one panel that's all vision, or one panel that's mobility related. So we will, like maybe I'll have a panel that's all sensory deprivation, whether it's vision or hearing loss. But the point here is you want to write your application so that the person on the street can understand it, because they may not know your technology. They're going to know disability, and we practice the social model of disability, not the medical model, by the way. So, write your application to the person on the street and take those 40 pages to explain things. Explain it, especially if it's complicated, explain it in more than one way if you have the room. The other link is to NIDILRR's SBIR program, and I think that needs to be updated, but it's worth clicking on to take a look at the information there. Next page, please. Also, you want to go to acl.gov and take a look at our parent organization. It's not it's not directly related to your application, but the more you know about the place where you're applying, the better you can talk the talk that may impress reviewers. And at acl.gov, if you click on this link or search for NIDILRR, you'll on this link you'll find out about our other funding mechanisms. And as a small business, I would pay attention to the field initiated programs. In particular, it's a 3-year grant for $200,000 a year, and it has a research leg as well as a development leg. And you can apply to both SBIR and field initiated. At the same time, the applications are different, but nonetheless, you can't take money for the same project from both mechanisms, but you can increase your chances of getting an award that's related to the work you're doing. Take a look at the FIP and think about it, and the other programs that you'll see at this link as well. The next link is to NARIC, NARIC.com, and NARIC is our clearinghouse of information. There's all kinds of information about NIDILRR, the work we do, and the world of disabilities. And then the link after that in particular takes you to NARIC's program database. And when you're looking at the NARIC website, if you click that first link, the shorter URL, on the right, you'll see a blue tab. I think it's called Program Database. That's what this next link takes you to. And there's a lot of search possibilities there. You can limit everything to just SBIR phase 1 and see what we have funded. If you look at all the various drop-down boxes, you can just type, like if you want to do a development project that involves wheelchair technology, for instance, you can just type wheelchair in there and look at everything we've done. And then you can click on the grant number, which is linked to the abstract. And you can read abstracts there, as well as the principal investigator and the program officer like me. And you can, ask questions and maybe seek collaboration. And you can do this for SBIR. You can do it for the field initiated programs, the FIPS I keep talking about it. You can do it for our model databases, for our model programs, our Switzer program, our rehabilitation engineering and research centers, all of our programs. You can find all of our existing and past funded grants there. Very good resource for you before you write an application. And then the next link, Donate Your Brain to Science, is our peer reviewer training module. So here you can get in the heads of a reviewer, see things from their perspective, and that can help you to write an application from the reviewer's point of view. And if you perhaps don't have time to be an applicant yet, you can be a reviewer if you have the skills that match the kinds of applications we get. You can be a reviewer for SBIR. If you're applying for SBIR and you're still interested in being a reviewer, you could possibly be a reviewer for the FIP program or some other, program by getting your name out there as a reviewer. And if you would like to send me your resume, I can send it to the corresponding program manager. You can also find those program managers by going to the link about NIDILRR. And when you go down there, you'll see who the program manager is. Some of those need to be updated. We've had a few retirements. If you don't find the right person, or if you want to just use me, feel free to send me your resume. Our competition season is not up and running yet. The Switzer, no, I'm sorry, the art programs. Art programs and SBIR are the first couple to come out. So you'll start seeing applications drop around the beginning of October, and then it gets pretty fast and furious, and then we're recruiting reviewers pretty steadily, from Thanksgiving on. And then this link at grants.gov, here I plugged in the search key phrase for you, NIDILRR, so that's just saving you a little trouble. And then I did not check this last link for all of ACL's current announcements, but you can also scroll through the website and find the opportunities there. It looks like that might work. Next page, please. So yeah, tips for success. This is important. You must meet the needs of people with disabilities just to be eligible, and you need to identify your population. Now, this is tricky because, to be a commercial success, your population can't be too narrow, but then you can't say we're going to help, everyone with a disability in the world, or in the United States, all, 83 million of them or whatever the number is now. That's too broad, and the reviewer is going to see through that. So you want to identify a population, like maybe it's, here's one of our grants that we have right now. It's a wheelchair cushion with sensing technology to help people who get pressure sores. That, so now your population is wheelchair users, and it can be, spinal cord injuries, cerebral palsy, and all the other things that put people in wheelchairs. And you want to be very specific about that. And you also want to cite things. Like if you say there are, 2.4 million wheelchair users in the United States who experience problems with pressure sores, you want to do a literature review to back that up. Where did you get that information? Who wrote that study? And, you want to cite that stuff in the bibliography using APA style. So a literature review helps you to identify the population. It helps you to identify the problem. It helps you with the state of the science. What's out there already? Why is yours better? What's not out there? What gap are you filling? So you need to, the more you can show reviewers that you learned this, you didn't make it up, the better your application will be received. So yeah, what is the population? What is the problem they experience? Again, in the case of the wheelchair cushion, it is, pressure sores. And, what is your solution? And that is, in the case of the wheelchair cushion, it's sensing technology. Maybe it's an auto-adjusting cushion with compressors and air bladders and things like that. But, don't go too far with that example. I don't want to put anything in your heads, but whatever you are developing, develop the population, the problem, and the solution using a literature review. And the state of the science is part of that. So it is field initiated, and you will take anything. But if you want to send me an email and a one-pager to vet your ideas, especially if you're not sure about eligibility, if you're not sure, I would like to save you the trouble of applying in case it might not be eligible. So please send me an email with your ideas. The criteria is around the middle of the funding opportunity announcement. When you go to grants.gov and download that package, you'll see it's somewhere in the mid-50s, 50 pages long. And around the middle of that, maybe page 22 or 23, is the criteria. And our criteria is much different than the NIH. Importance of the problem is 25 points. Quality of project design is 50 points. Facilities and staff are 15 points, budget's 10 points. I forgot what each one of them is, but you want to use those and the sub criteria that fall underneath them as your guide, your cheat sheet, and include that in your table of contents so they know where to go to find importance of the problem, the reviewers, that is. Because the more they hunt and peck, the more frustrated they get. There's a lot of reading, running a panel with 8 applications or so. I mean, that's a lot of applications at 40 pages of project narrative, and then budget narratives, and, letters of support. Oh, letters of support. Include letters of support for anything. I mean, don't overwhelm the reviewers with 42 letters of support. But if you're going to, rent the facility, if you have a mentor, if you have a vendor in mind, if you have someone who's donating anything, someone who's, giving you expertise, people who are, what's the phrase I'm looking for? Stakeholders, people with disabilities, where are you going to get them from? Are you going to get them from Easter Seals? You have a letter of support for Easter Seals. If you're going to use a laboratory or a hospital or whoever you're going to recruit from, if you're going to rent stuff, if you have a vendor who's going to give you, some information or loan you equipment, universities, vendors, businesses, whatever, letters of support are helpful from applicable organizations. Again, I follow that criteria format like a cheat sheet, and under the criteria, like for importance of the problem, there are 3 sub criteria. It's 25 points in total. Don't try to divide 3 into 25. It doesn't work out. And reviewers use their own discretion in spreading that, that value out among the sub criteria. So yeah, download that most recent funding opportunity announcement. It's going to be very similar, especially the criteria. I don't see any changes there. Right to the person on the street, avoid jargon, explain concepts, especially if it's technical. I already mentioned, know the current state of the art, what's out there, why is yours better? Cite that knowledge. Don't just speak from personal knowledge or experience. And here again, I have another grants.gov link to subscribe to it. I may have put that in there more than once, but it's useful. Next slide, please. So again, this is the peer reviewer training module. Please do go there. And our peer reviewing doesn't pay well, but it's great experience. It looks good on a resume, and it helps you to write an application. So please consider, volunteering as well, I say volunteering, we do pay. I think we pay $800 to be a reviewer. And that's, so let me tell you a little bit about the review process. We have 5 reviewers on a panel, and you'll, as a reviewer or as an applicant, there will be anywhere from 6 to 10 applications per panel. And again, it's a variety of experience. The review lasts 3 days, the live review, where you're on Teams or Zoom with the review panel. It lasts 3 days. But before those 3 days, of course, you have to read and score and comment on the applications on your own. And we give you 3 to 4 weeks to do that. Then you all get together for 3 days and you talk about the applications. It usually only takes 2 days, but the 3rd day is kind of a wrap up. Sometimes it goes into the 3rd day, depending on how much the reviewers talk or if anything was controversial. And this is, much different from the NIH. We do not use a triage. We do not use a second level of review. We pretty much fund down the slate when it comes to reviewer scoring. Occasionally we deviate from that a little bit, but we don't say, oh, we don't want to fund any of those this year, let's move on to the next thing. We pretty much follow reviewer recommendations. So reviewers are very important to our process. And again, if you're familiar with the NIH, it's totally different. Next slide, please. Okay, so I will stop for questions here, although I do have a Word document with more links and more information that I want. You know what? I think before I do that, before we go to questions, I should go through that slide, that document, because it will probably answer some questions. So if you could thank you very much. So our next phase 1 competition should be released October 16th with applications due December 18th, 60 days later. These are just forecasts. Here is a link to that forecast. Once the funding opportunity announcement is published, you'll be able to download it from this link. Let me know if you have any troubles accessing that. Our phase 2 competition should be released in around January 5, with applications due 60 days later on March 5. You must be a phase 1 grantee in order to be eligible to apply for phase 2. Again, either from NIDILRR or from another federal agency with an SBIR program and an SBIR grant. I have another link to NARIC here. Subscribe to that newsletter. and then you'll get information once or twice a week about all of our funding mechanisms, as well as other work happening at NIDILRR. Again, the more you can talk, the better. Yet another link here to grants.gov with the NIDILRR search phrase plugged in for you. And of course, all projects funded by NIDILRR Small Business Innovation Research Program must address the needs of people with disabilities directly. And that's important because people have wanted, I mean, we don't fund prevention, except for maybe pressure sores, but those are people with disabilities. We don't fund medical cures. We don't fund medicine. And we don't, like someone might say, okay, we want to do something for patients, so that when we go in so that when people go into the hospital, they have all their patient records on this, cute microchip. We wouldn't fund that because that benefits the general population. It may benefit people with disabilities coincidentally, but that is not the target population. People with disabilities must be your target population. And of course, it must include research and development of a product or service. Again, designed to improve the lives of people with disabilities. And, this is SBIR. The goal is to sell this product to make money for your small business. We're happy to see if you sell things, how much of a success you are. That's up to the reviewers to decide in your phase 2. Your phase 2 will include a business plan. Phase 1, of course, does not. A project that proposed service provision without a research development component will not be considered. So if you want to start a home health agency, that's not going to be funded unless you're doing something really specific and different that addresses a population. Again, we don't fund mobile apps any longer, but we do have program opportunities available, such as the FIP, without that restriction. Again, grants.gov, and here's that keyword NIDILRR plugged in for you again. Can you scroll down a little bit, please? So the same SBIR links that I have in my PowerPoint are here. So I won't bother going through them again. The project database is the same. Reviewer orientation is the same. And the small business help deck is the impact center is the same. Okay, so that's everything. A little bit of duplication here, but it's better to have it twice than not have it at all. So I had contact information on my final slide of my PowerPoint, and I'm happy to answer questions, now through email or give me a call, but it's hard to reach me by phone. I generally like email better. I can give you more detailed responses. So I'll stop and see if anyone has any questions now.
Great. Thank you so much, Brian. And thank you for letting me know it's NIDILRR instead of walking through all the letters. It's a lot easier.
I should have done that sooner. Sorry.
No, it's all good. So we do have one question submitted, and I have a bunch that I can ask too if there aren't more. But this one is, how would a bidder identify intellectual property in their proposals? In phase 2, who owns the IP, the government or the contractor?
So yeah, the data rights are I'm not an expert on this as well as I should be, but government has first rights technically, but that was, in my opinion, designed around the military end of the SBIR program, where the government uses the technology, or the NIH, where they're using the vaccines that are developed or whatever. We don't want it. It's in there because that's the language that is in the policy directive. But we're not going to use your technology. But to identify anything that is sensitive information that you don't want shared, there's instructions in the funding opportunity announcement how to identify that. And we do have a data sharing information for phase 2s, but it doesn't apply to phase 1s, and that information is in the funding opportunity announcement. But yeah, we're not interested in it, but we have to provide language accordingly.
So then this question is kind of a follow-on, which is having a provisional patent always advised in that case?
It's not necessary. We are just starting to use iEdison for reporting patents, and I'm not really familiar with how that works yet. But whether we don't fund SBIR program doesn't fund patent applications or anything like that. And there's no harm in getting one, of course, but that's totally up to you.
Great, thank you. So this is a question I get a lot, and it's, if you are a one-person company, can you still win an award? Have you seen it be, a solo?
Especially at NIDILRR, yeah. Especially at NIDILRR, where it's kind of, these products for people with disabilities is very niche. Yep, happens a lot.
Great, thank you. And I also get the question is, do you have to have a PhD if you are the PI on it?
No, not at all. Again, especially in SBIR. Now, other NIDILRR programs, it becomes more important, but no, not at all for NIDILRR. And that's kind of a sensitive point, but we don't care if you made it through high school. If you're developing something that helps people with disabilities, then you're our kind of person.
Great, thank you. So this person is asking, do you have to have a relationship with a university? And I guess they're asking about education too, but you just addressed that.
No, you don't have to. And if you are affiliated with a university, of course, the grant must go to the small business. We do fund a lot of university spinoffs, and is it going to help? It depends on what the reviewers think, and it depends on your relationship and what kind of support you're getting from them. As you know, in a SBIR program, only so much of the work can be done outside of the small business, 50% and 2/3 respectively. So there's only so much you can do, but it probably doesn't hurt to have the right expertise coming from a university, depending on how much of your project is research oriented.
Great, thank you.
And their letters of support would definitely be helpful if you're using a university for anything.
Yeah, makes a lot of sense. So I know some people always are curious about when you actually get the money. So kind of, if you could talk about the time frame a little more, since you said it'll probably open October, deadline December. Is when do the reviews happen? When is the decision made? And then when do you actually get the money beyond that?
That's a great question. Thank you. I should have addressed that. So if we stick with this timeline, and applications are due the middle of December, then our review process takes a while, because I have to find the reviewers and we have to assemble the panels. We have to give them 4 weeks to read everything, and then NIDILRR has to do their process. And once we're all done with everything, we have to wait for our parent organization, ACL, to approve everything and to get the funding in the right pockets and everything. So we try to meet the 90-day deadline. These projects will start June 1st, though. So that's, whether or not we meet the 90-day deadline, it's tough. We don't always meet it, where the applications are due and the award begins, and, we just don't always meet it. But we do hope to notify as soon as possible. And we don't always do it. I said it 3 times now, in 90 days, but there are things that ACL has to do that we can't control when it comes to notifying people. And there's congressional notification and getting all the money available, and it's not all in our control. But they will start June 1st, both phase 1 and phase 2.
Okay, perfect. That's really helpful. So this person is asking a little bit more of a specific question about a type of technology. So they're saying that you had said the technology should target persons with disabilities directly. So they're wondering if an educational software for training healthcare professionals would be applicable.
Yes. So, the line between we're having a problem with software, because some people are saying they're developing software when they clearly expect it to be used on a mobile app, and they're just skirting the restriction by changing the word mobile app to PC-based software. And now the lines are being blurred. But if your end result is helping the population of people with disabilities, and it's something you can sell for a profit. Whether the physician or the professional is paying for that doesn't really matter, as long as it benefits the lives of people with disabilities. And in your phase 2, you can demonstrate that it would be a commercial success. Yes, it is okay to be a professional service provider in that case.
Great, thank you. Let's see. This question is, have you ever had an applicant chosen who was close to covering all disability categories?
So, I would like to know what you have in mind that addresses, such a broad population before I answer that, really. But, yeah, I have trouble imagining what would benefit, mobility impairments as well as vision and hearing and cognitive, all of those. Yeah, I don't know, but it's possible. And if you can sell this and let the reviewers understand why it benefits such a wide population, you could be successful. Just don't overestimate what you can do with this. But again, I would really like to see this idea before I answer in detail. And please send it to me. We are, by the way, bound by confidentiality. So it's not like I'd lose my job if I, gave any of this information out that you send me.
Great, that's really helpful to know. So I will say to that person who asked that question, go ahead and email Brian after this. You will get his email address too. So it's probably the best way to handle this particular question. So I guess another question I would have is that, do you get reviewer comments after selections are made? If you aren't selected, do you have the opportunity to ask why you weren't and get feedback?
Really great question. Thank you. So yes, we provide reviewer comments to successful as well as unsuccessful applicants. And the idea is to provide constructive criticism that helps an unsuccessful applicant who maybe only scored a 65 to get a 100 the next time around. And that is, the goal that we translate to the reviewers and that we want the reviewers to translate to you, so that if you take this constructive criticism that you'll receive along with your notification letter, and we give it to successful applicants as well to help hopefully run a better project by taking the consideration of the reviewers into mind. We don't say, if you win an award and you get funded, you got funded for a certain set of goals and objectives, and we're not going to ask you to change that, but we're going to ask you to think about what the reviewers said. So the strengths and the weaknesses, as well as general comments, will be included for all successful and unsuccessful applicants, along with my contact information, so we can have a discussion about, if you want, you can contact me to have a discussion about how to interpret, perhaps I don't want to say interpret, but how to use reviewers' comments, and maybe to help you understand what they were trying to say, to apply again. And you can apply over and over at NIDILRR. We don't restrict the reapplication process in any way. Just ask that you consider the reviewer's feedback in your reapplication.
Fantastic. That's a really great offering that you have, because I know not all agencies do that. So that's really great.
Yeah, we're small, so I get to do that.
Yeah, wonderful. So I guess the other question would be, can you submit multiple phase 1 projects for consideration?
You can apply for 5 different things if you want, or there's no limit to as many things as you want, as long as they're different enough. And the one thing you have to be really careful for is, so let's say let's go back to pressure sores again. Let's say you're developing software and hardware for a pressure sore mat for beds or wheelchairs, and you want to apply for a phase 1 for the software and a phase 1 for the hardware. Well, what if you don't get one of them? Where does that leave you? So if your applications are dependent on each other for the same product, then that's a problem. But on the other hand, like let's say you got a phase 1 to develop a pressure sensing mat, and you develop the mat, and that's all you developed was the hardware, then you can apply for another phase one to develop the software, because you already have the hardware. It's not like, are you going to get the award for the hardware? If you've got it now, you can move on to apply for phase one for another part of that component. And by the way, you can even apply for a mobile app if it's connected to a piece of hardware that is also being funded under that project. So again, the pressure sensing cushion comes with software for a smartphone, but that's connected to the cushion, to the hardware. So that's allowable. And you can even have a product that you need to improve. Maybe you need to miniaturize it, or maybe it needs wireless control, and you want to take this product and make it a wireless product. So you can apply for a phase one and a phase two to improve existing technology, or even if it's just an existing prototype.
Fantastic. Thank you. I think that
really
clarified a
great
lot.
questions. Thank you.
Yeah, thank you. So I guess another question would be, I think you kind of addressed this to some extent, but the TRL level, so technology readiness level for phase one, some people might already be selling in the market. So is that too far beyond what you could apply for phase one? Or how can you structure that, I guess?
Well, yeah, and we get a lot of that actually. And the way to structure it is that you're making a significant improvement to the existing, whether it's a prototype or a commercialized success. If you're improving a commercialized success, cool. The reviewers are probably going to like that, because you know how to commercialize and you have a product that works, and you just want to make it better. The water bottle I mentioned, actually, that's what it was. They had a commercial success, and they improved just the arm that the water bottle sits on for the wheelchair, and they got an award for that. They only needed a phase one. They didn't actually need a phase two. Yeah, and then, there's a lot of different ways to apply to improve a device. You might even only want a phase one to research how to improve a device, and you might not even be working with it other than holding focus groups and testing it with stakeholders. That becomes very specialized, and you have to present these things to the reviewers the right way, because that can be a kind of a narrow focus. But I was going to say something else. I'm stalling to try to remember it, but I forgot.
No worries. Maybe it'll come to you.
Yeah.
So this person was asking, if you have a technology that can have unrelated applications, like computer vision, would you do that within the same phase one application, or should you do multiple ones? This might be one where they have to talk to you separately, but if you have any.
Yeah, I would say we need to talk about that one, because it depends on how much money you need to do the work. I mean, we don't want you to pound a square peg into a round hole by trying to combine two things into one grant. But again, if they're dependent on each other, unless you can do it in phases, and by phases, I don't mean phase one and phase two. I'm, specific. I mean, like you may want to develop one thing now with a phase one and a phase two, and then later develop another thing, or apply. If they're not dependent on each other, you can apply to two different. You can send us two different phase one applications, as long as they don't sit on each other.
Great, thank you. So I guess I don't know if you're comfortable talking about other parts of Health and Human Services and how their processes might be different. You said NIH has a totally different review process. If you can touch on, any of those differences with NIH, CDC, FDA, anything that you're able to, speak to any differences.
So all of the places you mentioned, the CDC and FDA and the NIH, although the CDC and FDA are not part of the NIH, they're sort of like us. They're down in another leg. They participate in the omnibus. So your application, and I don't work on the omnibus, so I'm speaking as an outsider, but my understanding is that your application goes into a pool, a bucket, an omnibus, and it gets spun off. So if you're developing something that helps with kidneys, you're going to go to the NIDK, and that's who's going to get your application, and that standing panel of specialists is going to review it. If it's, neurological, then it's going to go to the NINDS, and that's who's going to, that's the panel that's going to look at your application. Occasionally people apply for things that benefit the lives of people with disabilities, and they are introduced to us through the SEED program or through the NIH. My colleagues out there will sometimes send things like that our way, but we're not part of it at all. And if it gets spun off into an agency, then it's they're all different. But my understanding is that often they have a two-tier review where they'll either look at it up front and say, no, we're not funding wheelchair technology this year. We've done too much of that. We just don't want to do that. And you might get kicked out just for that. Or they'll review you, and then, at the end, they'll say, well, this, the same thing can happen. They can say, we're not interested in that. But I don't honestly know the delineation there, but they do triage, and they do have a second level of review where they say, we aren't interested in this, or we've already got 3 of these that we're funding, so we're not going to fund this one too. I honestly don't know the inner workings of that, but we're not that way. And we don't have the standing panel, we don't have triage, we don't have a second level of review. They only allow 7 pages, I think. Their scoring mechanism is much different. We use a 0 to 100, just like grade school. And they don't score that way. A lower score is actually better there. And they have the NIH holds an SBIR conference every year throughout the country, and you can go to those, and they have mock reviews, and I've been to 1 or 2. You can watch the review process, and it's different. But it's been a while since I went. That's what little I know about it. I don't know how many days they take, or if they're in person. Our reviews are virtual. No one comes to DC. It's all virtual.
Great, thank you. So I know you said it's out of the 100 points for, NIDILRR's system. So this question was, let's see, are all application scores out of 100 points in the review summary as per the strengths and weaknesses?
Yes. So again, when you look at the criteria, you'll see the 25 points for importance of the problem and so on. So you'll get, from 0 to 25 in that one. And then quality of project design, you'll get from 0 to 50. And it all adds up to your final score. We don't have a pay line. Like, we can't say, we don't fund below 80% or anything like that. Most winning applications are, in the mid to high 80s or 90s, but we don't have a hard, fast pay line. The reviewers try to be objective, but the only thing I see that that applicants get bothered by is you might get an 85 the first time around and reapply and get an 83 the second time around, and wonder why you actually scored lower when you tried to incorporate reviewers' comments. But you're never going to get the same 5 reviewers, but hopefully their feedback is helpful. Most people don't go in that direction, but it can happen.
Got it. Thank you. So I think that's all for the questions that have been submitted. If there's any additional ones, please feel free to put it in the Q&A part. But Brian, I did want to leave it to you if there's anything that you want to say as a summary, or, best practices, anything. I know you already said about the best practices, but anything you want to kind of drive home for people at this point.
The biggest thing is to not wait for the funding opportunity announcement to come out, but to get in there and take a look at it now. Read it more than once. Read it before you apply, and then read it while you're applying, and then read it after you apply to see if you missed anything. The first time you read it, you'll probably come up with some questions for me, and I like those questions. So please send them to me. It's better to ask first than to apply. So don't feel that you're bothering me. That is my job. And don't worry about confidentiality. Your stuff is secure with the reviewers. Also sign confidentiality agreements. So don't be afraid to apply.
Sounds good. Well, thank you so much. And sounds like Brian is very available to, everyone after this. If you do have follow-up questions, sounds like emailing him is a great option for you to, have those questions answered. We will follow up today with a recording and slides and that handout that you saw. So you'll get them after today's session. Thank you again, Brian, for being here today and sharing all this great information.
Thanks for doing this, Jamie. Bye.
Bye.